Blackheads are one of the most common, most stubborn skin concerns, and they can feel especially frustrating because they often seem to refill no matter how much you cleanse or how many products you try. The good news is that blackhead prevention is usually very achievable when you understand what a blackhead truly is, what keeps pores congested, and how to build a routine you can follow consistently without irritating your skin. Everything you'll hear here is general skincare education, not a personal medical diagnosis. Skin is individual, and if you have severe acne, painful deep bumps, frequent infections, significant scarring, eczema, rosacea, or if you are pregnant or nursing, it's safest to speak with a qualified clinician before starting strong active ingredients or making major changes. For most people, the path to fewer blackheads is not more force or deeper cleaning. It is calmer, steadier pore care that keeps the follicle environment stable over time. To prevent blackheads, it helps to understand what they are. A pore is the opening of a hair follicle. Even areas that look hairless usually have follicles. Many follicles are connected to sebaceous glands that produce sebum, your skin's natural oil. Sebum is not bad. It protects the skin, reduces water loss, and supports a healthy barrier. A blackhead forms when sebum mixes with dead skin cells and becomes trapped inside the follicle. The pore opening remains open to the air, and the top part of that plug oxidizes and turns dark. That dark color is oxidation, not dirt. This matters because one of the biggest reasons blackheads persist is that people treat them like dirt and try to scrub them out. Scrubbing harder, cleansing more often, using harsh cleansers, using frequent pore strips, and squeezing aggressively can all irritate the pore opening and damage the barrier. When the barrier is stressed, the follicle lining becomes more reactive, swelling can increase, and shedding becomes less coordinated. That makes clogs more likely. Prevention works best when you treat blackheads as a pore function issue, not a cleanliness issue. Another critical point is that not every dot you see is a blackhead. Many people look at their nose and assume all those tiny dots are blackheads, but many are sebaceous filaments. Sebaceous filaments are normal oil channels inside pores. They often look like small gray or tan dots, fairly uniform and closely spaced. They refill quickly even with excellent skincare because they are part of normal anatomy. True blackheads tend to be darker, more distinct, and more irregular in distribution. You can improve both, but if your goal is to eliminate every dot on your nose, you may overtreat your skin and create irritation that makes pores look more noticeable. A healthier goal is smoother texture, fewer true blackheads, and a slower refill pattern. Pores are normal structures, they do not open and close like doors, and they cannot be permanently erased, but they can look far less noticeable when they are not inflamed and not filled with compacted material. Blackhead prevention rests on a few pillars that work together: cleansing that is effective but gentle, a consistent pore normalizing treatment strategy, barrier support through moisturization, daily sun protection, and avoiding the habits that inflame pores and keep congestion returning. If you want one guiding principle for everything that follows, it's this: choose a routine you can repeat comfortably for months. The routines that work are the ones you can maintain. Let's start with cleansing, because prevention often fails here in one of two ways. The first is cleansing that is not thorough enough, especially at night, leaving behind sunscreen, makeup, and daily residue that gradually loads pores. The second is cleansing that is too harsh and stripping, which damages the barrier and triggers irritation and sometimes rebound oiliness. The ideal cleanser removes sweat, excess oil, and buildup without leaving your skin squeaky, tight, or stinging. Tightness after cleansing is not a sign of deep cleaning. It's a sign of barrier stress. Barrier stress makes skin more reactive and can make the follicle lining shed less smoothly, which contributes to clogs. Morning cleansing should be based on how your skin feels. If you wake up oily, sweaty, or you slept with heavy occlusive products, a gentle morning cleanse can help. If you wake up comfortable or slightly dry, rinsing with water may be enough. For many people, the most important cleanse of the day is the nighttime cleanse, because that is when you remove sunscreen, makeup, and environmental buildup. One of the most overlooked drivers of persistent blackheads is incomplete sunscreen removal. Sunscreen is essential for skin health and becomes even more important if you use exfoliating acids or retinoids, because those can increase sun sensitivity and because UV can worsen inflammation and prolong post-acne marks. But sunscreens are designed to stick to the skin, and many formulas are water-resistant or long wear. If you wash quickly and leave a thin film behind, that film can mix with oil and dead skin cells inside pores. This is why people sometimes feel like sunscreen breaks me out. Often the issue is not sunscreen itself, but an adherent formula paired with incomplete removal. A practical and gentle solution is to use a first step at night that dissolves sunscreen and makeup, followed by a gentle water-based cleanser that rinses everything away. The first step can be micellar water, a cleansing oil, or a cleansing balm. The second step is your usual gentle cleanser. This is often called double cleansing, but it doesn't need to be harsh and it doesn't require aggressive scrubbing. It simply matches cleanser chemistry to what you need to remove. If you wear water-resistant sunscreen or long-wear makeup, double cleansing is often one of the most effective ways to prevent pores from slowly accumulating residue. Your skin should feel clean and comfortable afterward. If you feel stripped, reduce friction, shorten the time you massage, switch to a gentler cleanser, or avoid hot water. Hot water can increase irritation and dryness. Now let's move from cleansing to the pore itself. Blackheads form because dead skin cells and oil become trapped and compacted inside follicles. So prevention needs a strategy that improves shedding and reduces the formation of microclogs. Two ingredient families have strong track records for blackhead prevention: salicylic acid and retinoids. Salicylic acid is a beta-hydroxy acid, often called BHA, and it is oil-soluble, meaning it can move into the oily environment of the pore lining and help loosen the mixture of sebum and dead skin. Retinoids help normalize cell turnover and reduce the tendency of dead cells to stick together inside follicles, preventing microclogs from forming. Both can work extremely well. The key is not choosing the strongest product, the key is choosing a plan your skin can tolerate consistently. If you choose salicylic acid, think of it as steady pore maintenance rather than an aggressive peel. Many people do well starting with a salicylic acid product 2 or 3 nights per week and increasing gradually only if the skin stays comfortable. Some people prefer a leave-on salicylic acid product, while others do better with a salicylic acid cleanser. A cleanser can be gentler because it rinses off and contact time is short, while a leave-on can be more directly effective but may irritate if used too frequently too soon. The biggest mistake is starting daily use right away, feeling dryness or burning, stopping, then restarting, which keeps the follicle lining unstable. The goal is not to force visible peeling. The goal is consistent, comfortable use. If you experience burning, persistent redness, or peeling in sheets, reduce frequency and focus on barrier support. Irritated skin often clogs more easily, and irritation can also make pores appear larger and more obvious. If you choose a retinoid, technique and patience matter more than intensity. Over-the-counter options include retinol and retinaldehyde, and in some places adapalene is available without prescription, while other retinoids require professional guidance. Regardless of which retinoid you use, the principles are similar: apply a small amount, apply to completely dry skin at night, and increase frequency slowly. A pea-sized amount for the entire face is typically enough. Using more product does not create faster results, it usually creates more irritation. A smart start is 2 nights per week for a couple of weeks, then every other night if tolerated. Many people never need nightly use. If dryness occurs, buffering can help. Apply moisturizer first, then retinoid, then another thin layer of moisturizer. Buffering does not cancel effectiveness, it reduces irritation so you can stay consistent. Retinoids often take about 8 to 12 weeks for noticeable improvements, and improvements continue over months. If you are pregnant, trying to conceive, or nursing, do not start a retinoid without medical guidance. Do you need both salicylic acid and a retinoid? Many people do not. Prevention is about consistency, not maximum intensity. Too many strong actives can raise irritation, and irritation can worsen congestion. If you choose to use both, a safer strategy is alternating nights rather than layering them on the same night, especially while building tolerance. It is also appropriate to have rest nights where you use only moisturizer. Those rest nights are not wasted. They help keep the barrier healthy, and the barrier is what makes consistent use possible. Now let's talk about the skin barrier, because barrier health determines whether your routine is sustainable. The barrier is the outer protective layer of skin that helps retain water and keep irritants out. When the barrier is compromised, the skin becomes more reactive and inflamed, and the follicle lining can shed less smoothly. That can contribute to clogs. Many blackhead-prone people avoid moisturizer because they fear it will clog pores, but the right moisturizer can actually improve blackheads by reducing irritation, improving tolerance to actives, and supporting more orderly shedding. Choose a moisturizer texture that feels comfortable. Lightweight lotions or gel creams often work well for congestion-prone areas. Ingredients like glycerin, ceramides, and panthenol can support the barrier. Niacinamide can help some people with oil regulation and barrier support, but a subset of people find it irritating, especially at higher concentrations. If a product stings or causes flushing, choose a simpler formula. The best moisturizer is the one you can use daily without discomfort, because comfort supports consistency, and consistency supports prevention. Daily sun protection is also part of blackhead prevention. UV exposure can contribute to thickening of the outer skin layer over time, which can worsen uneven shedding and congestion. UV can also increase inflammation and make post-acne marks linger longer. If you use BHA or retinoids, sunscreen is especially important because your skin may be more sun-sensitive. If you feel sunscreen worsens congestion, troubleshoot rather than skipping it. Often the solution is choosing a lighter texture and ensuring thorough nighttime removal. Many blackhead-prone people do well with lightweight fluid or gel sunscreens. The goal is a sunscreen you will actually wear daily and can remove comfortably. Now we address the habits that sabotage prevention. This is a major reason people feel like nothing works. The first habit is harsh scrubbing or frequent physical exfoliation. Scrubs can create microirritation and disrupt the barrier, inflaming the pore opening and potentially worsening congestion. If you use chemical exfoliation like salicylic acid or a retinoid, you usually do not need a physical scrub at all. The second habit is frequent pore strips. Pore strips can pull out surface material temporarily, but they often remove sebaceous filaments that naturally return, and they can irritate the pore opening. Irritated pores often refill faster and can look larger. The third habit is aggressive squeezing and picking. Squeezing can rupture the follicle wall, increase inflammation, and increase the risk of scarring or dark marks. If you choose to extract occasionally at home, keep it rare and gentle. Use clean hands, avoid sharp tools, and stop immediately if the plug does not release easily. Never dig. Never continue until the skin breaks. For widespread or stubborn congestion, professional extraction by a trained provider is often safer and more effective than repeated home trauma. Hidden triggers can keep pores congested even when your skincare routine is good. Hair products are a major one. Pomades, oils, heavy conditioners, leave-in products, and styling creams can migrate onto the forehead, temples, and cheeks and contribute to congestion, especially along the hairline. If you notice blackheads clustering near the hairline, keep heavy hair products away from your face, rinse conditioner thoroughly, and consider washing your face after styling if product touches skin. Nighttime contact matters too. Hair coated with product rubbing against cheeks during sleep can contribute to clogging. Small changes like clipping hair back or switching to lighter products can make a noticeable difference. Sweat and friction are another common trigger, especially under masks, helmets, straps, or tight hats. Heat, humidity, and friction can swell the pore opening and trap sweat and oil, sometimes leading to acne mechanica. The solution is not harsher cleansing or scrubbing. The solution is gentle cleansing after sweating when possible, avoiding heavy occlusive products in friction zones, and keeping the barrier supported so skin is less reactive. If you can't cleanse immediately after exercise, even rinsing with water and gently patting dry can help. Makeup can also contribute if removal is incomplete. Heavy base layers and frequent touch-ups can add buildup. Brushes and sponges hold oils and residue. cleaning tools regularly can reduce pore clogging buildup. If you suspect a specific product is triggering congestion, simplify and reintroduce products one at a time so you can identify triggers. Often mystery blackheads improve when removal becomes more thorough and tools are cleaned more consistently. Skincare texture choices matter too, particularly if you have combination skin. Many people have an oilier T-zone and drier cheeks. If you apply rich, occlusive creams heavily to the T-zone, you can trap oil and worsen congestion. Zone-based skincare can help, lighter textures on the nose, chin, and inner cheeks, richer support only where skin truly needs it. If you use facial oils, use them sparingly and consider mixing a small amount into moisturizer rather than applying oil directly to the areas where you clog most. Now let's bring this into a routine you can actually follow without overthinking. In the morning, cleanse gently only if needed. If you wake up oily or sweaty, use a gentle cleanser. If you wake up comfortable or slightly dry, rinse with water. Apply a lightweight moisturizer if needed, then apply sunscreen. At night, remove sunscreen and makeup thoroughly, cleanse gently, pat skin dry, apply your chosen active on dry skin according to a tolerable schedule, then moisturize. That is the core structure. What changes from person to person is which active you choose and how frequently you can tolerate it. If you want to introduce active safely, build tolerance rather than trying to fix everything fast. Start one main active at a time so you can clearly see how your skin responds. Begin at a low frequency and increase slowly only if your skin stays comfortable. If you experience burning, persistent redness, or significant peeling, reduce frequency and strengthen barrier support. Calm skin sheds more predictably. Calm skin clogs less easily. Calm skin also allows you to continue long enough to see meaningful changes in pore behavior. Timelines are important because unrealistic expectations lead to overtreatment. Blackheads rarely disappear overnight. You are working with the follicle cycle and the shedding process inside pores. With consistent salicylic acid use, many people notice smoother texture within a few weeks, but meaningful reduction in blackheads often takes 8 to 12 weeks. With retinoids, noticeable improvement often appears around 12 weeks and can continue improving over months. The most common reason prevention fails is not that products do not work, but that people switch too quickly, add too many products, or stop because of irritation. Choose a plan you can tolerate and give it time. If you want an objective way to track progress, take a photo every 2 weeks in the same lighting. Day-to-day mirror checking often leads to frustration and unnecessary changes. You may hear the term purging, especially with retinoids. True purging refers to microclogs coming to the surface as turnover normalizes. It typically occurs in areas where you already clog and gradually improves over several weeks. Irritation